Ine ndali ndi yani chipapo kuno kwa Mwalala group khuluwiri. Mavuto amene atipezekera kuno ndi kusowa kwa msika wa kofetereza. Kwadima kumene kudaganiza kuti angabwere fetereza sanabwere ayi. Ndi pamene komiti yamudzi kuphekeza ndalangizi ndi pamene inadzotolera chani inadzotolera maidi kuyesetsa kuti kapena mwina wanthu wawo angapeza chani angapeza chakudya. Ndatatolera maidi wadza kuphekeza ndi ndalama komiti yachitukuko ndimene idapanga zimenezi kuphekeza ndalangizi. Ndiye maidi wadza ndi ndalama zitapita dakhala kenako pamene daona kuti amfumu akutitanitsa tikakumane titapita pamene kudza pamene ankati ifetu azilangizi ndi komiti yamudzi yachitukuko tatani talephera fetereza sanapezeke. Panopa anthu akudandaula kulira maidi pamodzi ndi chiyani ndi ndalama zawo sizidoneke tipanga bwanji mpeme tidangokhala kolilira kukusowa fetereza wasowa kupezeka minda wanthu olimalima kupezeka chimanga chose chidonongeka chifukwa nthaka yakwathu kuno tidayizoweleza sitingolima popanda fetereza ayi.
I am Felix Sanudi, Programs Manager for Community Initiative for Self-Reliance, CISA. The organization, in partnership with Civil Society Agricultural Network, with support from Vetunga Health and the Federal Ministry for Economic Cooperation and Development, is implementing the Strengthening Rural Governance for the Right to Food project at T. Lulanga's area in Mangochi district. The project is applying the human rights-based approaches in making sure that the community members are empowered to demand for their rights, and also duty bearers improve the quality of service delivery with regards to the right to adequate food. One of the ways in which the project is making sure that the right holders are able to demand is through application of social accountability tools. Social accountability is an approach towards building accountability that relies on civic engagement. In social accountability, right holders hold duty bearers and service providers into account in their conduct and performance in delivering services that relate to their rights. CISA, through the project, has applied social accountability tools such as the community scorecard, social audit, and public hearing to gather the perception of communities, to verify the beneficiaries, and also to interface with the government in order to improve the delivery of the service. The social accountability process was conducted on Affordable Impulse Program, a flagship program by the Malawi government. In the Affordable Impulse Program, right holders are provided with subsidized inputs such as fertilizer and maize seeds to improve their production and to ensure that their right to food is met. In order to have a successful community scorecard exercise, there are several steps that need to be followed. The first step is to plan and prepare. Under this step, there is need to define the scope and develop the indicators together with the communities and the duty bearers. There is also need to familiarize the communities of the tools that are going to be used during the scoring exercise. There is also need to train facilitators, because facilitators play a very critical role to make sure that the community scorecard process is successful. After training of the facilitators, then the second step is to score with the communities. During scoring with communities, community perception on the delivery of the service is rated, and after that, in the third step, there is a scorecard with the service provider. After scoring with the service provider, then there is an interface meeting between the duty bearers and right holders to score on the indicators that were developed during the community scorecard exercise. During the interface meeting, actions are drawn, and in the fifth step, there is need to follow up and monitor the actions that were developed. While the community scorecard was conducted to gather people's perception on the implementation of Affordable Inputs Program, we also conducted a social audit to validate the findings from the community scorecard and the report by the Mangochi District Council. During the social audit process, data on the actual list of beneficiaries who benefited from the Affordable Inputs Program was requested from Mangochi District Council. Secondly, there was sampling of the actual beneficiaries who benefited in the scheme. After sampling, a tool was developed to do the actual verification using the Aquaflow. After development of the toolkit, enumerators who would do the actual verification of the beneficiaries were trained. After that, the actual verification of the beneficiaries was conducted at household level. Finally, there was an analysis of the beneficiaries who benefited in the Affordable Inputs Program.
My name is Joseph Makwagwa. I'm the CESO chairperson for Mangochi CESO network. Our role basically as a network is to provide platform in the district for information sharing, networking, and also coordination. So one of our partners is CISA. CISA is implementing a project, Right Food Project, in the district. And as CESO, we have partnered with them.
CISA collaborated with CSOs at district level in the implementation of the social accountability process. This was a very important step because it strengthened the evidence that was built on AIP because we had other CSOs that were doing similar initiatives in other districts, so we were able to consolidate the findings and bring them together. But again, this is also very important because it ensures effective monitoring and following up on the process where other CSOs are able to support monitoring in areas outside the project area.
The community scorecard was conducted. In terms of the findings, we are sure that they will shape or help this office or Mangochi District Council in responding to real issues, discover the real issues which the communities are facing in regard to the Agriculture Input Program as AIP, which this district council is implementing through Agriculture Office. So with this community scorecard, we are sure as a council, as a sector, to come up with the tailor-made recommendations, because these recommendations will come from the communities themselves.
After conducting the community scorecards and the social audit, we conducted a public hearing. So during a public hearing, we brought together right holders from the targeted areas, but also duty bearers from both national and district that are responsible for the implementation of the AIP program. So this space enabled the dissemination of the information or findings from both the scorecards and the social audit in terms of what the beneficiary's perception or the right holder's perception of the program was.
Basically, this has been a very, very important activity as far as CESO networks is concerned, because now we have evidence on actually what people say about the AIP and what are the recommendations.
But also it created an opportunity for right holders to be able to testify themselves, their experiences, both good and bad, of the implementation of the program.
Mangochi tibweresa zipangizo sizimataniso sizimabwera ndepempho amene mmayang'anira katundu amene uti chonde ife anthu ako akatuli tikudandaula misewu yathu ndi yathu yotani ili ndi mvuto ulibe tala ndesi kuti tikufuna tala koma zipangizozi zibwere fertilizer kuchako sipongo kwati.
Programu imeneyi ndiye bwino kwambiri kamba kuti imathandiza anthu ovutikisisa amuzi. Ulendo uno kudera lino la Fort Magwaya tinali ndi anthu opindula kwambiri ovutikisisa amene mayina awo anatuluka pa programu ya AIP. Ndipo mayina atatuluka, programu inayambika. Mafumu tinakhala pansi nkukambirana kuti kodi ndama ngati magulidwe a fertilizer tizipanga bwanji. Fertilizer inalipo ndipo anthu anapindula pang'ono. Pachifukwa choti ku Fort Magwaya ATC tinawuzidwa kuti kuli ma supply angapo amene angapange supply kuno ku Fort Magwaya mbali ya fertilizer, mabungwe okwana 4. Kuma makampani onse 4 olo kampani imodzi sinafike. Ndi Admark yokha yomwe inaoneka kuno yomwe inagwira ntchito ya AIP.
Poor security on beneficiary IDs. Zite zomagwirisa ntchito ID tigwirisa ntchito chala. Ngati boma silingakwanise ndipezebe alternative yoti anthu azigwirisa asamaberane chifukwa kuli chisawawa. Malipoti akuonesa kuti 74% kachani kwa kugulidwa wa NPK, 84 wa urea, koma zimenezo zili mmapepala. Tikapita kumuzi anthu sanagule fertilizer mokwanira.
Adding on to that, people were able to ask questions that needed to be clarified by the relevant stakeholders, as well as it is a place where action plans were drawn on how communities, together with civil society, but also in collaboration with the duty bearers, are going to follow up on the process.
Social accountability is a governance issue. It focuses on how different programs land on the communities. And in the course of interaction, it gives the opportunity for duty bearers to gather information on how policies can be reviewed or developed.
During the public hearing, recommendations were drawn by government in terms of the challenges and the issues that needed to be taken up and addressed to ensure that people benefit from the AIP program.
Advocacy efforts by civil society organizations to balance funding across all these areas can never be unnoticed. The government also recognizes the need to redesign the administration of the Affordable Inputs Program, taking into account issues of fiscal sustainability, value for money, cost efficiency, and effective delivery with minimal gaps. That is why we are present here today to learn from the perspective of CSOs and farmers on how we can improve the program. Malawi government also recognizes the importance of ensuring that its citizens are guaranteed of their right to vote.
In concluding the public hearing, government made a number of commitments in addressing some of the challenges that were raised by right holders, some of which included to ensure timeliness of delivery of farm inputs to the communities in line with their farming calendars, but also to ensure security of the electronic system of delivering farm inputs, to address some of the corruption issues that right holders were experiencing. And a recommendation was actually to introduce a biometric system, but also lastly to ensure verification of beneficiaries and ensure that they really benefit the intended people in the communities. Yeah, so advocacy, change does not happen overnight. Yeah, it's a progressive thing. Right holders, in working hand in hand with the civil societies, committed through an action plan to keep on following up by the commitments that were made by government to ensure that they are really addressed in the next AIP season.